All right, so for testing of the submaximal cycle ergometer test with your client that you are testing with, you are going to want to first gather their basic information, so age, height, and weight, and record this on their sheet. Once you have that, you're going to take a rough estimate of their max heart rate that you want them to reach, which an easy way to do that is do 220 minus their age, and that's going to be their max heart rate. And they're also going to find their 85% max heart rate as well. Once you do that, you are going to want to have your client get on the bike, measure it out correctly to make sure that their legs, when fully extended, still have about 5 to 10 degrees of flexion with them. So once you do that, you're going to have them rest for 3 minutes and then grab that baseline heart rate and blood pressure, which we discussed in the first video. After this rest, we're going to have them start their the warm-up stage. So on the bike, they're going to be pedaling for 50 revolutions per minute. An easy way to do this is use a metronome or a metronome on your phone or something so they can hear those beats, and making sure that they're getting those revolutions every minute and that they're staying on cadence throughout. So once that warm up, there's going to be 0 resistance through that. Once that happens, then we're going to officially start the stages. So during stage 1, you're going to go up to 0.5 for resistance, and you're still going to be at that 50 revolutions per minute. So once that starts, you're going to be at this stage for 3 minutes. The first 45 seconds, you're just going to have them pedal. And then those 15 seconds between the first minute, you're going to palpate their heart rate. After that, you're going to have them pedal some more. And 15 seconds to the second minute, you're going to take their heart rate again. And then during that second minute is when you're going to take their blood pressure. After that, you're going to have them continue pedaling at that 50 revolutions per minute until you reach the third minute. Once that happens, you're going to bump up the resistance again, 0.5 watts. So then it's going to be at 1 for stage 2. Same thing, you're going to take the heart rate and blood pressure at the same times during that 3-minute period, making sure that they're reaching steady state every single time. Once that happens, because we're only going to do 2 stages, we're going to have them go back down to 0.5 for resistance to have a cool down phase. So during that, you're going to have them continue monitoring their heart rate every 2 minutes after that, to make sure that their heart rate is coming down. And once their heart rate is under 120 beats per minute, they can stop. You just want to make sure that they reach their rate, make sure you're monitoring their symptoms throughout to make sure they're doing okay and they're not at risk for anything. And that is how you do the submaximal cycle ergo meter test.